President Rodrigo Duterte bans all travels for Filipinos to and from China, Hong Kong, and Macau. For 400 years, this has withstood the test of time. Manila Mayor Isko Moreno says that finding those who are accountable will come after. It's another showdown and clash of political clans here in San Juan. After 10 years, justice has been served. Tristan Udalo, CNN Philippines.
Hello everyone and welcome to The Doctor is In. I am your host, Dr. Freddie Gomez. So the number of COVID-19 cases continues to rise every day. At kahapon sa panayam natin kay Dr. Anthony Leachon, National Task Force, sinabi niya na wala pa tayo sa peak ng sakit na ito. Sa dami ng pasyente sa ngayon, pag-uusapan natin kung paano nga ba ang handling o pagtugon ng mga ospital sa emergency cases pagdating sa COVID-19. So to help me answer your questions and to talk more about this topic, we have in the program Dr. Marc Lamberto Reyes. Siya ang chairman ng Emergency Medicine Department sa Asian Hospital and Medical Center. Thank you for joining us, Dr. Reyes.
Thank you, Freddie. Thanks for having me. Magandang hapon sa buong Pilipinas. Thank you.
Now, Dr. Reyes, alam natin na ang emergency room, ang lugar sa ospital kung saan nyo tinitignan o binibigyan yung atensyon ang pinaka-critical na cases that need immediate attention. So kung ang isang tao ay COVID positive o may sintomas ng COVID, dapat ba siyang dumiretso sa emergency room?
Okay, madami pong symptoms ang maaring may pakita ng isang taong may COVID, no. Ito ay lagnat, ubo, sipon. Yung iba naman nagtatae din, no. Like any other flu-like illnesses, no. Pwede naman ho siya sa bahay lang kung ang simptomas niya ay hindi naman malala, no. If you think that your symptoms are regressing or nahihirapan ka ng huminga, no, sobrang panghihina at sobrang taas ng lagnat, pwede naman po kayong pumunta sa hospital at check up sa emergency room. Pagdating po dito, kayo i-check up ng ating mga doktor sa emergency room at nurses at we will determine if you need to be tested for COVID-19. Hindi naman po lahat ng pasyente, no, na may simptomas ng COVID ay natetest natin due to the lack of testing kits that each hospital has for patients. No, hindi pa ho natin kayang i-test ang buong bayan para sa COVID-19.
Posible ba, Dr. Marc, na pwede niyong pauwiin ang isang person na may simptomas ng COVID? Pwede niyo ba siyang pauwiin sa bahay? At kung pwede man ito, ano yung mga criteria na sinusunod nyo para sabihin, okay, meron kang simptomas ng COVID, pero mas maigi na umuwi ka muna at mag-quarantine?
Pwede naman, no, Freddie, no.
Dr. Marc?
Sinabi ko kanina, pag ang simptomas mo ay sorry. Medyo pangit ng signal, pero tulad ng sinabi ko kanina, Freddie, no. May simptomas mild at ubulat na naghihintay ng kanyang test, no, for COVID. Usually pinapakain sa ng mga bahay at ina-isolate, no. We instruct these patients na umuwi sa bahay, i-isolate ang kanyang sarili ng 14 na araw, no, habang hinihintay natin kung na-test sila sa ospital ng COVID testing, no. So meaning pag ina-isolate po natin sila sa kanilang mga bahay, dapat po nakabukod talaga sila sa mga kasamahan nila sa bahay, no, para hindi po sila makaawa. Ito po ay umaabot ng 14 na araw na quarantine.
Okay, so just to reiterate, people shouldn't be worried if they go to a hospital feeling they have positive COVID-19 symptoms and then pinauwi sila ng doktor. So they shouldn't worry about that. There are some criteria that it is better to actually sit it out at home, and not stay at the emergency room. Ngayon, Dr. Marc, paano naman yung mga you deemed na dapat silang magstay sa hospital? Meron bang designated lugar ang mga posible may COVID sa emergency room? Nakahiwalay ba sila sa ibang mga pasyente?
Tama ka dyan, Freddie. No, we have designated spots in the emergency room. In Asian Hospital, the setup is we have two separate zones. We call it the hot and the cold zone. Yung hot zone po, dyan po namin nilalagay lahat ng suspected COVID or mga PUIs. No? Yung cold zone naman, ito naman po yung lugar na doon po namin nilalagay yung mga pasyenteng hindi naman po nagpepresenta ng COVID illnesses. No? Tulad ng mga inaatake sa puso, no? Iba na nag-appendicitis, hindi naman sila pinahalo sa mga taong suspected of COVID. No? Tutulad ng sinabi ko, na nilalagay po natin sila sa hot zone. So these are isolated areas. No? So we have rooms with negative pressure and with ventilation. So doon po namin sila ina-examine. No? Yung ibang mga hospital, meron po silang isolation tents na doon po nila sinusuri at ina-examine yung mga pasyenteng suspected of COVID. So pag ang pasyente naman ay nagpe-present na ng malalang simptomas, no, na tulad ng severe respiratory failure or nahihirapan huminga, medyo may edad na po at madaming comorbid, yun po ang mga kinakailangan ng confinement. Doon po natin bubuhos lahat ng ating resources para mailigtas ang buhay ng taong with severe respiratory illness suspected of COVID.
Ngayon, alam na lahat ng tao na itong panahon ng COVID-19, very pushed to the maximum ang mga hospitals when it comes to patients. A lot of patients are coming in with symptoms of COVID-19. Paano naman, Dr. Marc, yung mga emergent cases such as stroke, MI, or heart attack, yung mga abdominal pain, or yung mga na-aksidente? If any of these symptoms are seen in a patient, can they still go to the hospital?
Yes, of course, Freddie. No, these are the hospital makes sure that we have enough space for these kinds of injuries and illnesses. No, hindi naman ang hospital po hindi lang naman para sa COVID-19 patients. No? We have to remember that we have other patients that needs immediate medical attention. So we make room in the emergency room, and we try to make sure that we have rooms to admit them. In Asian Hospital po, the operating room is still functional for non-COVID patients. Hindi ho lahat ng pasyente dito ay COVID lang. No? We try to make sure to cater to everyone's needs. Hindi naman po natin sila pwedeng pabayaan.
That's good to know, Doctor. Now let's talk a little bit about yung triage, kung tawagin. Could you explain to us, Dr. Marc, what exactly is a triage?
The triage system, no, like any other emergency room, is where we sort out patients. No, we determine if they're non-urgent, no, urgent and emergent. No, dito po natin nasusuri yung mga klase ng pasyente na para malaman po natin who needs the most immediate medical attention. So dumadaan po lahat ng pasyente sa emergency room sa triage.
So, you mentioned pagsusuri, no? Paano ba sinusuri ang isang tao para maging isang person under investigation or PUI or isang possible PUM?
Okay. So una, no, we have to differentiate what PUI and PUM is. No? Ang PUM, usually these are patients with no symptoms. Wala akong simptomas itong mga PUM patients na to. Usually they are just exposed to patients, no, na tulad ng na-expose sila sa taong may suspected of COVID, no, na they get worried and they go to the hospital, no, to have themselves checked. Ito po yung PUM na walang simptomas pero exposed. Ang mga PUI po, no, ito po yung may mga taong may symptoms. Yung may mga simptomas ng lagnat, ubo, sipon, no, nagpupunta ho sila sa ospital para ma-check. No? Since we have already local transmission, they are already considered as PUI. So meron din pong dalawang klase ng PUI. No? Meron pong PUI with mild symptoms and PUI with severe symptoms. No? Yung PUI with mild symptoms, ito po yung mga medyo mga bata nating mga kababayan na nagpunta sa emergency room, no? Based on our Department of Health guidelines, since wala pa tayong mass testing center for COVID, we don't necessarily need to test them for COVID, no? They are usually sent home for home quarantine din kasi we really don't have enough space for them to be admitted and to be observed in the hospital, no? I'm very happy that the government is doing its best to make sure that we have quarantine centers all around Metro Manila, NCR, and the whole Philippines. No, this is where the government plans to put the PUI patients. But I think now, no, they just opened today, and in the near future, pwede doon ilalagay po lahat ng PUI patients with mild and moderate symptoms. Yung pangalawang klase naman po ng PUI, ito po yung may mga severe, no, respiratory illnesses, no, yung medyo may edad, may diabetes, may high blood, at medyo nagre-respiratory failure. Ito na po yung ina-admit natin. Tinetest natin kaagad for PUI. At some of them are unfortunately put in the ICU because of the severity of the illness, Freddie.
Meron ba katotohanan na Dr. Mark, marami nagsasabi kasi na mas madaling mahawa ng virus ang mga nasa triage. May katotohanan ba to, Doctor?
Actually, magandang question yan, Freddie. No? Sa lahat naman po ng hospital, no, the administration, the physicians, and the nurses themselves make sure that the people who are in the triage area is complete with personal protective equipment. So hindi naman po sila ihahain doon ng exposed. No? As long as they have PPE, so tinatawag nating personalized protective equipment, which consists of a gown, a mask, gloves, boots, headgear, and goggles, they shouldn't fear of getting infected. Safe naman po.
Okay, so okay, that's good to know, Dr. Mark. So we have to pause for a quick break, but when we come back, pag-usapan natin kung pwede bang magsagawa ng COVID-19 test ang lahat ng ospital. So along with that, please keep your questions coming and we will be answering your online questions with Dr. Mark when the Doctor is in returns. Welcome back to the Doctor's In. I am Dr. Freddie Gomez. And we are still here with Dr. Marc Lamberto Reyes, siya ang chairman ng Emergency Medicine Department at the Asian Hospital and Medical Center. Patuloy ang pag-uusap natin na Doc Mark. Marami pang nagtatanong kung lahat ba ng ospital ay pwedeng magsagawa ng test para sa COVID-19.
To answer your question, Freddie, no, there are hindi naman po lahat ng hospital sa NCR can do COVID-19 testing, no. Most of the big hospitals, no, Makati Med, Asian Hospital, Cardinal Santos, no, St. Luke's Global does COVID-19 testing, pero hindi ho lahat ng hospital sa Pilipinas is able to test for COVID-19.
Now, in your opinion, Dr. Mark, how important is mass testing? Gaano ka-importante po ang mass testing? At sa tingin nyo, advisable pa rin ba ang contact tracing?
Yes, importante po yung mass testing, no? Tulad ng sinabi ng ating epidemiologist kanina, no? This is the only way we will know if the trend is going up or going down, no? With this, we will know what to do, no? We can prepare, we can boost up our manpower. We can plan for things to fight the infection by knowing how the trend is going.
Ngayon, let's talk about naman yung napaka-importante natin mga frontliners. This includes all the doctors, the nurses, the medtechs, everyone who is involved in trying to treat patients with COVID-19. Ano sa opinion nyo, since nandyan na kayo sa emergency department, what is the best way how we can protect our frontliners?
Well, syempre, no, unang-una sa lahat, no, our paradigm talaga is, our plan is to give enough PPEs to all the health workers in the hospital. No? Not only to the doctors and the nurses, we have to give them from the security personnel, no? From our cleaners, to the staff, to the administrative staff, to the clerks. Lahat po ng tao sa hospital actually, especially in the emergency room, needs to wear PPE. No? Kailangan po natin iprotektahan ang ating health workers. Lahat po sila, walang exception.
On a side note, Dr. Mark, what is the current situation now, especially in your ER? Are PPEs still in dire shortage? Aside from masks, yes, we know that, but there are a lot of people who are trying to help with the PPE situation. What is it like now? Kulang na kulang pa rin ba?
You know, I'm really amazed and thankful to our countrymen. No? The community response to our call for help is really tremendous. No? Napakabait po ng ating mga kababayan. No? Hindi lang po sa PPEs. No? Nagpapadala po sila ng pagkain. Lahat po ng basic needs ng isang health worker pinadadala nila. From food, inspirational cards from children, no? And PPEs to that matter. No? Kahit nga ho pinapadala na nila para makatulong lang, no. The PPEs dumarating po sila, no. They are donated. No, we are trying to order PPEs from abroad. Meron na rin pong local manufacturers na nagpapadala po, no. Hindi yung iba nga ho hindi na nagpapabayad, no. Sa kasalukuyan po kulang pa rin po, no. We cannot know how long this battle will last, no. But we have to be prepared. No, we're preparing actually on a day-to-day basis. No, I think and I'm not pretty sure, but I think we have enough for a couple of days. Then after that, we'll have another shortage. So we need continuous supply of PPEs. No, sana nga ho. No, kung may mga mababuti tayong kababayan at mga kaibigan na at kahit mapagpadala ng PPEs or makapagbigay sa amin ng points where to get them. Malaking tulong na po sa amin yun. Pero sa Asian Hospital po, I think we have enough for a couple of days.
That's definitely good news and good to know. Now, Dr. Mark, join me please in trying to answer some of the online questions na pinapadala ng ating mga viewers. So we have a question from Laika, who is asking, bawal po ba magsama ng kamag-anak kapag magpapacheck up kung may simptomas ng COVID?
No, hindi naman po natin maiiwasan na magsama ng alalay or kasama, no? Especially when the patient is an elderly, no? No, hindi naman, or sa mga bata, hindi naman po natin silang pwedeng maiwasan na walang kasama, no? Ang pakiusap lang po namin, no, if sasamahan niyo po ang pasyenteng may suspected of COVID, no, please wear gloves, no, and wash your hands regularly. So we cannot avoid companions, no. Kahit pagbawalan po natin yan, hindi naman natin pwedeng pagbawalan. Pero once na na-admit na po ang pasyente in the ICU or in rooms that are isolated for positive COVID patients, hindi na po talaga sila pwedeng samahan sa kwarto.
Okay, we have another question from Bernadette, and she would like to know, magkano po ang kailangang i-prepare in case maging COVID patient ka? So very practical si Bernadette. Gusto niyo malaman kung magkano ba dapat ang perang i-ready niya in case na COVID patient siya.
Dako, mahirap na tanong yan, Freddie. No? You're asking, magkano, you broke up. So did I hear right? Magkano ang gagastusin ba? Tama ba?
Yes, that is correct. Magkano kailangan nilang i-prepare kapag pupunta sila at maging COVID patient sila?
Medyo mahirap sagutin
so is
yan, no? Freddie, depends on. It depends on how serious the COVID illness is. If it's mild or severe.
But in case for some of our Filipino brothers and sisters, kapag na-admit sila with COVID, pasok naman pa ito sa PhilHealth and other nationwide insurances, Doctor?
Yes. No, sa Asian Hospital po, no, we honor PhilHealth, and may pinangako naman po ang PhilHealth natin, no, that they will cover if not all, most of of COVID positive patients. So wala hong dapat ikabahala ang ating mga kababayan dito.
All right, that's good to know, Dr. Mark. So before we answer another question, we have viewers watching from Qatar, Oman, Malaysia, Dubai, Singapore, the UAE, Saudi Arabia, Kuwait, and China. Thank you for watching, and hello to all of you. Hopefully all of you who are watching in all parts of the world are staying healthy and safe. So let's continue some of the questions with Dr. Mark. We have another question from Arben. What if po may health anxiety ang isang tao? Ano po ang magandang advice ninyo para maiwasan ang sobrang pag-iisip about COVID-19?
No. Magandang question yan, Freddie. No? One, hindi ho tayo pwedeng mag-isa. No? We have to talk to someone. Hindi naman kailangan po doktor. No? We have to talk to a friend. You have to talk to your family. And do not bottle this up on your own, because mahirap po talaga at mahirap po talagang mag-alala at wala ho kayong kinakausap. No? Meron naman po tayo mga online na medical websites or web that you can do online consultations for this. Pero ang payo ko sa nila, if you're anxious, no, talk to someone, no, see your psychologist or psychiatrist. Pwede naman po natin itong gawin online.
Okay, now in line with that, Dr. Mark, I heard there is what's called a relaxation hub set up for the frontliners there at Asian Hospital. Could you tell us more about that?
Oh, so a relaxation hub. Yeah. No, I'm thankful for our administration here at Asian Hospital. No, they built a relaxation hub which caters to the mind, the body, and the spirit. No, they provided us with materials to read spiritually, some snack, and some massage chairs for the body, and some books to read, no, and spiritual guidance for that matter. So salamat po sa administration ng Asia na nagbigay po ng ganitong pagkakataon sa mga empleyado ng Asian Hospital.
Yeah, that's good to know, because I'm pretty sure the frontliners are in such a large amount of pressure, no? So that will anything will definitely help to ease their minds a little bit. So we have another question actually online from Jennifer, who's asking, kapag po tapos na ng home quarantine ang mga asymptomatic, babalik pa po ba sa ospital para magpa-test ulit?
Pag na-test po sila, halimbawa na-test po sila as positive, ito po yung mga positive na hindi naman na-confine. No? They will be quarantined for 14 days. No? After that, they will have a test, no? Another test, COVID test, to check if they're already negative. No? Pag negative po sila, kailangan po ng another test, no? The third test, na negative after 48 hours. Ito po yung mga na-home quarantine na positive. No? Tulad na sinabi ko, hindi naman ho lahat ng ating COVID positive patients confine. Para sa mga asymptomatic na home quarantine for 14 days, no, hindi na ho, pag wala na ho silang nararamdaman after that, hindi na ho sila kailangan bumalik at i-test ulit.
Very good, very good. So with that, we'd like to thank you, Dr. Mark, for sharing your time and expertise on this topic. We salute you and all the frontliners out there.
Salamat, Freddie. But before I end, no, I'd like to thank CNN and to remind everyone that the front line starts from the community. No, hindi naman po hospital lang at healthcare workers ang front line. No, the front line starts with you, the people in our community. No, without your help, no, without doing self quarantine, without doing hand washing, without social distancing, we will not flatten the curve. No, you will help the frontliners, the healthcare workers a lot. No, if you do this. No, the only way to beat this pandemic is with God's grace, and if we work together, this is the only way to win the battle against COVID-19. With that, salamat Freddie, salamat CNN, at magandang hapon sa inyong lahat.
At thank you rin sa mga viewers ng The Doctor's In. Sana nakatulong kami ni Dr. Mark sa pagsagot ng mga tanong ninyo. We will see you again on Monday after the Holy Week break. So sa ulitin ko po, Monday na po tayo magkikita muli at 3:30 p.m. I'm Dr. Freddie Gomez. Take care everyone and hope we were able to help.